rTMS is repetitive transcranial magnetic stimulation. We're essentially using electromagnetic pulses to be able to stimulate your brain and to be able to treat different conditions. So it's been around since like the 1990s. TMS has Health Canada and FDA approval for treatment-resistant depression. Meta-analysis or systematic reviews have shown that rTMS does have evidence for anxiety disorders, PTSD, cognitive impairment, as well as chronic pain.
So by bringing up the activity in that area of the brain, it kind of brings that area to a normal, healthy, functional level. But it also helps that part of the brain communicate better with the neighboring parts of the brain and create a healthy brain circuit. So by targeting one part of the brain, it's actually bringing the whole brain to a more healthy level of functioning.
So a lot of people with depression, there's a particular part of their brain that's quite underreactive. It's not talking to the other parts of the brain in a way that promotes good wellness and mood. And then once you have that circuit and those parts of the brain talking to each other, we see a reduction in some of the symptoms of depression.
So depending on where we target the brain, what frequency we use, we can help various types of disorders by tapping into different types of circuits.
Starting off, it was very mysterious and interesting because it's basically going to a room and there's a big machine there kind of whirling and making sounds and not really sure what a magnet is going to do for your brain. What the overall effect of the TMS has been for me is that I feel like I can be myself without having to deal with my mental illness all the time.
I just want people to know that they're fully awake, they're fully conscious through everything. If they sense any discomfort, it's really safe. I think most of the questions just come from people being completely unfamiliar.
So first thing, they'll have a consult appointment with the doctor to kind of talk about what's going on, what their goals are for treatment, and then together with the doctor, they'll come up with the rTMS protocol, so basically the treatment plan. And then once that's done, they're good for their 6 weeks of treatment, come in every day, and throughout that time, they'll have follow-ups with the doctor, talk to the techs as well, so we can kind of monitor, make sure they're comfortable and happy throughout the treatment.
You know, outcomes start to come around that 2 and 3 week mark. It does get less painful, it does get really tolerable. Some people fall asleep during the treatment. Like they get so used to it that they can just take a little nap. So just patience is key.